All right, in this video, we're going to talk about bowel function as it relates to our pelvic floor muscles. So we can see the purple and green layers represent our pelvic floor, our diaphragm. All right, we're going to go into that deeper green layer. Know that the purple layer would be similar to the external anal sphincter. It's more superficial around the rectum. And that deeper green would be the puborectalis. So let's take a look at that. So up close, we can see that the puborectalis forms a sling to tilt the rectum into this L shape, and that provides resting continence. The puborectalis is striated muscle. All right, it's different from the internal anal sphincter, which is smooth muscle, which is not under our somatic nervous system. So we wouldn't be able to train that muscle, but we can train the puborectalis, as well as the external anal sphincter, which is there in purple. So that would be a normal muscle. There's resting tension, right? So a reminder that our pelvic floor muscles are designed to have endurance, so they should be able to hold those muscles contracted for longer than 4 seconds, longer than 9 seconds. All right, and so when someone with the defecation reflex will allow the puborectalis to stretch as well as the sphincters to stretch. All right, so it's stimulated, that reflex is stimulated by stretch to the anal canal. However, sometimes people will have dyssynergia where the sphincters are contracting even in the presence of the movement of stool down into the lower rectum. This can be due to chronic muscle tension or chronic constipation. And so you may have to treat that muscle group by exercises that help stretch and elongate the pelvic floor. Hopefully those stretches are like deep squats that allow gravity to assist in the elongation of the muscles. And then you may also have to use manual therapy or a pelvic wand to help address stretching of that green puborectalis muscle. Others may have more difficulty with incontinence. Bowel incontinence can be due to pelvic floor muscle dysfunction, due to weakness, what you'll see is that green muscle is now too weak, too slack to keep the rectum in that tilted L shape. And so they will get leakage, unwanted leakage of stool. There may also be injury to the external anal sphincter. There could be small tearing or birth injuries that could lead to incontinence.